Where we live impacts how we live. And that journey sort of brought me to public health.
Finding public health is quite difficult, especially as a student who sees how multidisciplinary it really is. Now in college, I never understood public health. I took Intro to Public Health and I started to understand the little pieces of it, but there's so much more to it.
I love public health so much because public health is for everyone.
To me, public health is the study of humanity, its impact on itself, on the environment, on culture.
Public health is very much, as the name implies, it's protecting the population of the health at large and mainly focusing on prevention.
Even if you don't necessarily see yourself in public health per se, all of the systems and places where we live, learn, work, age, grow, worship, all of those impact our health.
We don't realize what it actually is doing in our everyday life, whether that's our schools that they're working on to ensure that students are safe, whether it's our neighborhoods, having a safety, environmental safety. It just spans every side of life.
So even if your career or your interests is a little bit outside of public health, the work that you do matters to keeping our society healthy as a whole.
I never considered myself doing a master's of public health because to me it was just policymaking, insurance, it was little organizations trying to do things, but it's so much broader than that.
Once you get out into the world and you meet people and you're able to ask them questions, that really just drives it home for how much of an impact public health can have on our communities when we're working directly with community organizations or the people that are living in our communities. I think when students get out into the community, they're able to see themselves in this work as well.
Seeing public health in my own life, I start seeing it everywhere. Whether I go on a campus, whether I go on a hike or wherever else, I just see the impact that it's making.
We're all interconnected. We all have similar needs.
You know, when I was going through high school, middle school, elementary school, they were doing stuff so that I was safe, so that my peers could be able to attend school. I think that it's the reason that my dad was able to survive cancer. All of those different projects and foundations that were out there, it's what kept him alive all these years. He has an autoimmune disease and then had a Burkitt lymphoma, and the only reason that he's in my life still is because of that. And he was an immigrant, a refugee. He had a hard life being in the States, but public health ensured that he was able to get the treatment he needed to the point where it's not a lifelong debt, and also allowing me to still pursue college without us all trying to survive life just from, whatever little pieces we had in our life.
Public health is for everyone, regardless if you see yourself working in a public health job or if you find yourself wanting to go a different direction.
Students have a lot of options with it. It's just really focused on where students want to make the most impact.
I just love the idea of becoming a disease detective, which public health seems my best route for it.
To become a physician, for instance, and you're working on that one-on-one care, public health will help you expand your thinking to say, well, how else is this operating? This is one person's experience, but what's happening at the community level? In public health, a good student is any student.
Students who go for public health have a lot of different goals in life.
Our program is better when we have students that are from a wide range of perspectives and experiences.
One of the best things about public health and the program itself is the faculty.
Not only are you going to make a difference in the future, but even within the program, you're going to meet other students who are going to potentially be your colleagues, future, partners working on figuring out how to help society.
The public health faculty, they really are able and they want to get to know you one-on-one.
I think I've met so many people that in the future, I'm excited to be able to contact and just share my own insights and work together to build a stronger community.
When we come together, each of us with our varied lived experiences, we can create solutions that are unique to different challenges and maybe sometimes that haven't been thought of before.
Something that's special about students who choose to go into the Masters of Public Health, not only are you studying for coursework, but you're meeting peers who potentially will be alongside you when you're trying to make a difference in this world, whether you contact them for consults or you get to just work alongside on a project. I think it's just really awesome that through the connections you make, you might potentially see students who work in the same organization as you in the future make an impact.
Whether you're an undergraduate student that is interested in public health in general, whether you're looking to get a master's degree or an accelerated master's degree, we have a home for you.
You're going to have opportunities to be in those smaller classes where you go even more in depth, whether it's sensitive subject, whether it's more detailed things. Some of my classes have 10 students or less. Some of my classes, you're going into the field. I know in previous times, students got to go and do epidemiology in the real world. They had to go house to house and work on those projects and really start something big. And I think that's really special about the program.
Students who are involved in our programs are also not shying away from asking, well, what else could happen here? How else could we make this world a healthier place? And I'm really grateful to be a part of that.
I feel that I'm as prepared as I can be through public health.
A year into the Masters of Public Health, I've not only met students who've worked for people I knew in the past, but I've also met some of the teachers of the surgeons that I've shadowed. I've also gotten to see and network with public health officials who were there during crazy times. We had a guest lecturer who was there for the Katrina hurricane, who was there for 9/11, who was going through all these experiences and getting to share that, and also seeing students who used to be in our program and are now working with them. And so it's just so rewarding to be a part of something that is so interconnected, globally, nationally, even within Corvallis as well.
Relationships really matter, and we really work to make folks feel supported and have what they need as they're tackling some of the hardest challenges that we have yet to see.
The flexibility, the possibilities are purely endless.